Well, good afternoon, everybody, and welcome to GPA Live. I'm your host, Ron Aaron Eisenberg. Delighted to be here with you. GPA Live is the educational seminar virtual brought to you by the Global Pain Association. Today's topic is a good one: fitness and chronic pain. Now, when you're living with chronic pain, exercise is often the last thing on your list. But as it turns out, it should probably be the first thing on that list, and we'll find out why when we talk with our very special guest today. He is Daniel Rubalcaba, a licensed personal trainer and a certified nutritionist. Daniel is also going to show us some exercises that we can all do at home. Now, before we welcome Daniel on board, let's talk with the founder and president of the Global Pain Association, Dr. Susan Blackwood. And Susan, as always, it is great to see you. Welcome to GPA Live.
Thank you, Ron, and good afternoon to you. And thanks for all that you do to every week bring this to so many people. We're now reaching 80,000 people that have watched Global Pain Live, and we're so grateful for your involvement, the Eisenberg Group for putting this on, and these experts that come in week after week to bring so much information to people that want resources about managing their chronic pain and their caregivers who are helping manage their chronic pain. So absolutely fabulous. Global Pain Association started in 2018. We had our first in-person event in 2019, and now we've gone and pivoted to go virtual for a few months now since last May, and it's been amazing how many people we've reached and how many people have been helped.
And for those who want to get involved with the Global Pain Association, there's a website and you make it easy to get involved.
Absolutely. And this is where they can see every week all of our segments in addition to our Facebook page, but they can email us at info@globalpain.org. And if they want to make a donation, we can talk about that a little later in the show, but they can do the same by going to globalpain.org/donate. And no donation is too small. That keeps these series going and will help us, and in the future, put on more in-person and hybrid events.
And for you, as the founder of the Global Pain Association, are you doing what you hope to do?
Oh, absolutely. It's exceeded every expectation our volunteer board and advisory committee would ever have. So we're excited about going forward and what else we can do to help be a resource in the community. We're looking for grants and other sponsors to help us even do a better job.
Well, Susan, we'll talk to you after we hear from Daniel. So don't go away. Stick around and we'll get right back to you. And maybe you can do those exercises along with us when he does his floor demonstration for all of us. And if you are in the Global Pain Association GPA Live chat box, please remember to share this broadcast. We want to attract as many folks as we can who can be helped by what we do here. So if you join us, if you've got a question, post it, and we will try to throw that at Daniel. And more importantly, let folks know about GPA Live. And I want to take a moment and introduce our very special guest today. Daniel Rubalcaba is a UTSA graduate, majored in kinesiology. His focus was exercise science. He's a licensed personal trainer, a certified nutritionist, and has more than 10 years experience in the field. Alio Fitness Club is co-owned by Daniel since 2015. It's been rated the top 5 best gym in San Antonio by the 2016 San Antonio Current. And Daniel's also a business investor, a developer, and more than anything, he can use fitness as a way for us to tackle chronic pain. So Daniel, great to see you. Thanks for joining us.
Hey, thanks. Thanks so much for having me today.
Now tell us a little bit about how fitness and chronic pain go together, because as you know, if you wake up in pain, if you have pain every day, exercise is the last thing you want to do.
Yeah, and that becomes a problem because it's discouraging, right? A lot of people that handle pain on a daily basis, and chronic pain would be anything considered 3 months persisting. So it's challenging because it's the last thing you want to do, feeling pain, having issues with your joints, and finding the motivation to go and try to help yourself. Oftentimes people refer back to medications to help with this. In my scenario, I'd like to work more on the foundations of exercise and fitness and how we can actually improve your daily motions, going through a series of different exercises, stretching, and working with mobility.
And how do you motivate people then?
My best form of motivation is understanding what the people go through on a day-to-day basis, leveling with them to feel exactly what they go through, and then giving them encouragement with, well, there's ways we can help you out. It's not just the end point. Let's start something fresh and give you something that you can look forward to long term.
And some of the things exercise can do are,
Yeah, what I've listed here, these are going to be the main key points. So reducing stress, regulating hormone levels, promoting better circulation, of course, decreasing inflammation, improving mobility, reducing fatigue, improving muscle hypertrophy and strength, as well as increasing flexibility. And these are some of the most important key points that I wanted to discuss with y'all.
and for folks who don't understand pain, you've got a great chart here: good pain versus bad pain. Isn't
Correct.
all pain bad?
It depends on what you're coming out from. So bad pain versus good pain, there is a fine line between the two. So good pain is going to be what you would involve in most exercise programs, right? So whenever you work out, you're going to be tearing down some of the muscle fibers. That's normal. That's good. This is what helps grow back stronger muscle fibers to increase muscle mass and strength. Now, when you start to feel sharp pains or a strong like tingling pain in your joints, that would be considered the bad pain. So something that's going to persist more than 1 to 2 days, that's outside of your typical muscle soreness, where it becomes more of an inflammatory response, that's going to be your bad pain. Anything sharp, anything that causes numbness, anything that decreases your range of motion, those are all going to be what you want to really be aware of and take precautions so that we can avoid injuring yourself long term.
And then there's other good pain.
Yes, so the different types of good pain would be something that's more in the muscles and not in the joints. So take, for example, a bicep curl. So we're doing a bicep curl. You start to feel pain in the bicep muscle itself, where it's a sore pain. It's not a sharp tingling pain. That would be normal. You'll go through your full range of motion. Now, once it starts to contract and become too tight, or you start to feel pain more in the elbow or in the shoulder, that's your joint pain. That's when you would stop. And that's when you would go on to either a different exercise or you would begin to stretch that specific muscle group. Now, as far as tips to consider during the flare-ups, so once you've already encountered the bad pain, how do you treat the muscles? So treating muscle soreness most commonly is done so by rest and hydration. Those are going to be your two main components. Hydration helps your recovery time a lot faster, and heating and icing is also recommended, but that's only if it persists for more than 1 to 2 days. Ibuprofen, of course, will help reduce the swelling meantime, and staying active instead of just sitting and being sedentary will definitely increase the recovery time as well by taking care of that. Now, which programs to choose? There's so many different programs, especially if you see a lot of things online. Everything looks different, and it's kind of confusing for most people because it's where do you start? That's going to be the most important part. Exercising for cardiovascular fitness, knowing what programs interest you the most. If you're a runner, if you're a swimmer, if you're a hiker or a biker, cardiovascular fitness would be most ideal for you. Walking around your neighborhood or on a treadmill for 30 minutes a day, we recommend 30 minutes a day. It doesn't have to be the starting point. Just 5 to 10 minutes alone. And there's been studies that show that this has improved chronic pain over the long term. And so it's just finding a comfortable spot for you, starting with that. But we recommend 3 times a week. And that's going to be ideal. It gives you enough recovery, but it also helps to enhance the program. Once you've become acquainted with the 30-minute walk, whether it's on a flat plane, that would be a good time to increase and go into something more hilly or into a power walk using either small weights or ankle weights. And what that does is just helps you prevent from plateauing so that way you can continue to challenge yourself. Now, if you're somebody who enjoys exercising with weights or a resistance training program, so exercises for strength training would be ideal for you. Some of the strength training programs include weightlifting, working out on machines. There's a variety of different equipment. At my facility specifically, we have a lot of different equipment here, and some of it is confusing because there's so many different types. Ideally, dumbbells, resistant bands. Those are going to be the easiest things to acquire and stuff that you don't need to go to a gym to have. Exercising machines are great, right? Because they help guide the motions. The problem is they also can put a lot of stress load at the joints. So you need to be cautious with how much weight you lift. Hiring a trainer or a guidance partner that can help instruct you will be important because that will help teach you the proper mechanics as well as make sure that you don't stress those joints. And then lastly, if either of those programs don't work out for you, and you're just wanting to start with the basics before jumping into that, a great option would be mobility training. So stretching before and after any type of movement, whether it's just getting up to walk outside or getting up to move around the house, there's two different types. So you have a dynamic warm-up, which is going to be something more with movement back and forth. For example, these guys right here would be a dynamic movement compared to an isometric, which would be a holding in that position for anywhere from 5 to 15 seconds, depending on the exercise or the stretch. And those two would be your main components for increasing mobility. What it does is it helps warm up the muscles, warm up the joints so that you're not as tight throughout the day.
You mentioned trainer. How do you find one? How do you know that someone can do what you want? And who would you ask for guidance?
Initially, you want to talk with your doctor just to get clear to make sure that you're safe to work out with a trainer or a physical therapist. Once you've got that down, finding the right trainer can be done so by looking online. I would find a reputable gym. So what we've done typically is find the best gyms or the highest rated gyms in your city and then go through the reviews to see what people have said about them. Once you've found the proper gym and you know that they have good reviews, contact that facility, speak to either the owner or one of the trainers, and schedule a consultation. Typically, most trainers or health studios will offer a complimentary health assessment. That's where they'll go over everything with you, make sure that you're safe to do the program, and guide you into the proper program that's going to be most suitable for you.
And for those programs, if you're at a point, Daniel, where let's say you can't afford a gym membership, if you can't afford to hire a trainer, I think a lot of this can be done at home. And you've got some demonstrations that you can give us on what we could do at home.
Exactly. And training at home was extremely popular during lockdown and making sure that people knew what to do at home. So we actually created.
You couldn't go anywhere.
Exactly. But there's so much things that you can do at home. So I brought a towel, right? This is something super simple. So a standard towel, I would use a smaller towel, not a really big towel. And the reason why is because you're going to want to hold it out in front of you just like this. Once you've got it in front of you, this is going to be working the anterior deltoids. That's the front of your shoulders. Wrap it up till you make a strap. You're going to pull from both ends. Pull from this end, pull from that end, keeping tension right in the center, and hold that for 5 to 10 seconds. You'll want to do this 10 reps. So once you finish that, rest for about 3 to 5 seconds, and then repeat it and do it again. Now, another way to help encourage the rest of your body is by doing this, sitting upright. So that way you're working your core, engaging your glutes by squeezing them together, and then do the same motion, holding them down, mid-range, and then you can do eye level. And those would be working the whole rotator cuff muscle groups. Now, the same thing goes for the rear. So we've talked about the front. You can also work the back. I'm going to remove this so that you can see what it looks like from the back. You would take the same example, hold it, and then pull out from both sides just like that. And what that does is that also helps work on keeping tension in the back. Now, for any other muscle groups away from your standard shoulder exercises or the stretches that we just covered, you can also use daily items just like these. I brought these right here. These are just disinfecting wipes. You can use water bottles or jugs if you want to go a little heavier, but these are going to be for bicep curls. So keeping your elbows back, chest up, hands over the bottles, and a full range curl all the way up, all the way down. From the side perspective, shoulders are back, all the way up, all the way down.
Now, if I do 3 of those, do I end up with guns like you have?
It might take a little bit more than 3, but if we do a couple of sets and some time involved, yes, definitely.
Now, what else can we do at home?
So some stretches I wanted to go over with the back, because the back is what 80% of people complain about having chronic pain in, and specifically mid to lower back. I'm going to show you an exercise right here that you can do at home. It's very simple. You're going to have a seat. You want to put your elbows up 90 degrees. Make sure your palms are facing down. We're going to rotate with the opposite arm. You're going to pull that elbow back, and the opposite hand, you're going to push forward. What that does, contracts the scapula, stretches in the rear delts, stretches in the lower back. You'll hold that 3 to 5 seconds, and then rotate, making a fist with the other hand, palm straight out, push forward, pull back. And that's stretching all in that midsection of your back. It's contracting the upper back, and it's engaging at the core. Same thing, 3 to 5 seconds each side. And you would do a total of 10. So 10 total. And you'd want to repeat that for about 3 rounds.
Now, how many days should we do this? Should we do it one day, rest the next, do it again?
Yes, I would do 3 days a week starting with, just to get started, 3 days a week. As you progress or as you start to feel better, increase that to 4 to 5 days a week.
And vary the exercises or just do the same ones?
I would vary. So start with the basics, which would be a few of the ones that I just showed you right here. I have a couple more. And then as you improve, you always want to do the rows of progression. So that way that you can see more improvements down the road. So some other ones you can do for legs, and this one's specifically for people who deal with plantar fasciitis. I want to make sure you can see me from here, but what we'll do is these are going to be heel raises. So heel raises look like this. You'll go onto your toes, raise your heels off the floor, hold that for 3 to 5 seconds, come down slow. So you want to push through the balls of your feet. Coming straight up, coming right back down slow. And this one you would do for 10 reps, and you would do that 3 rounds. And what that's going to do is help stretch right in the middle part between the heel of your foot and the balls of your toes.
And for those who have plantar fasciitis, pain in the bottom of their foot, those heel reps will help?
Yes. And going back to the towel, another very important one we can do right here, laying flat on your back, you put the towel right under the balls of your toes, lean back, you're going to push away with your foot as you pull back with your arms. And you see my toes, how they're pointing back towards my head? Kind of get a little gas right in there, pushing away as you pull back. That's another one.
Now, some folks, I don't know if you can hear me, some folks, depending on their age as they get older, find it difficult to get back up. If you're on the floor, what's the secret for getting up?
For getting up, see in the back I have TRX straps. I do have clients that are in their 70s and 80s, and whenever we do anything on the floor, I always make sure that we have something nearby that they can use to help pull themselves up. For example, this would be a strap, using the opposite arm to kind of pull yourself up to a standing position. So I always recommend either having somebody to help you or having a source that you can rely on to help assist you as you stand up.
And I gather, Daniel, before we let you go, age is not a problem. No matter what your age, you can exercise.
Yes, sir. Exactly. There's always a way of exercising, whether even if you're sitting down, it's just getting that heart rate going, getting the blood circulating, and mobility, movement. Some stuff might seem silly or it seem like it's not exercise, but it is. Just got to keep moving. Remember, nothing will happen unless you make it happen.
And for those who are watching, what are the final tips you'd like to pass on as we get off the couch and start to exercise?
That you're in control of your body at all times. So even though you have limitations or even though there's things that might seem like it's going to slow you down, just remember it's just a detour. You can always find another way.
And on this slide, you've got other tips.
Yes. So we talked about hiring a personal trainer that can guide and prescribe you, modify specific exercise programs. A lot of times, if you just go into a gym, you'll see that there's ellipticals, there's pools, Stairmasters, treadmills, spin bikes. All of those are great because they're low impact. You're able to do cardio and you're able to contain and remain on a steady pace for that. And that's if you're in a gym. Now, if you're not in a gym, remember, utilize space outside. So there's a lot of trails. I would start with a sidewalk, something that's simple, that's not as rigorous on your legs. And then as you progress, advance to hills or advance to more all-terrain. Other things you can do as well, I tell my wife this all the time. I say, all right, let's park a little bit further whenever we go to stores or whenever she's at work. Steps equal calories.
Yeah, most of us cruise to find the spot right by the store.
Yeah, I know. It's like, it's just easier, especially if you find a front row parking. It's like, it's just the easier thing to do. But just remember that steps do equal calories. They're important. So you want to stay away from the front row parking as much as you can just to get more steps involved.
Now, these guidelines are pretty good. Talk to us about it.
Yeah, so the first thing is setting a schedule that you're able to fit into your lifestyle. So we talked about having a 30-minute goal per day, something that you can fit into your routine. The most important thing, though, is finding what interests you. So not everything will fit that criteria. You don't want to jump into a cardio routine if you're used to a resistance training program. So remember, follow things that interest you. That way you're more likely to stick to it. And then organizing it. So prioritizing your activity levels, just like your body wants you to do it. And I said before, nothing happens until you make it happen. So make sure that you keep moving.
Now, calendars, you mentioned the other day when you and I were talking off the air, you need to put these in your calendar, the time, the days when you want to exercise. If you lock it in, you're more likely to follow the schedule.
Correct. So calendars are a great way to track goals. One of the things that we do is if you've reached that daily goal, you cross it out with an X. If you haven't and you skipped that day, then you put a circle. At the end of the month, you want to have more X's than O's. So finding that daily routine that's going to help to reduce that pain, making sure that you cross that day out if you've succeeded. And then if you haven't, you put a circle right there. All of this is just a way to kind of keep a reminder and make sure that you stay on track.
And sleep is important, right?
One of the biggest ones, and we recommend 6 to 8 hours.
Now, this is a list of sources that people can download and take a look at later when they go back to watch. Take a screenshot and you will have these. And Daniel, before we let you go, Patty in our chat box is asking, what about seated exercises? Are there good ones to follow where you can sit in a chair?
Yes, and actually I brought a ball. This is called a Swiss ball. This is more important than the chair because it helps you with your stabilizer muscles. So this is something you can purchase on Amazon. You would want to do a lot of them seated on something like this. So the rotations, neck.
But you got to be able to balance on that, right?
You do. And it's not that bad because if you see on this one specifically, it actually has sand in it that helps stabilize the ball. So this is a good starting point.
There's a TV commercial that shows a guy at his office trying to balance on the ball, and of course, he falls off on his butt.
Oh gosh. Yeah, those are going to be the ones that don't have the sand in it, and those are a lot more challenging to balance on.
So look for the ones on Amazon that have sand in it, which
Yeah,
will
you would type
help you
in
stabilize.
weighted Swiss ball.
Weighted what?
Swiss ball.
Okay, I got it. Thank you. Anything else you want to add?
That should be good. Sleep, hydration, stretching and mobility, finding the right exercise program that fits your criteria, and making sure that you have the proper technique and guidance to instruct you throughout the whole program.
And if people want to get a hold of you, Alio Fitness Club, 15909 San Pedro, or they can call you, right, at 210-259-9144, and no charge to talk with you on the phone.
No, we do the complimentary health assessments.
Thank you. Daniel, thank you so much. Appreciate it.
Thank you so much for having me.
And I learned a lot. In fact, I need to get my calendar going and lock that exercise in. Now let's take a moment and welcome Dr. Susan Blackwood back to GPA Live, and we can get an update from her on how folks who want to get involved can do so.
Well, Ron, thank you very much. Thank you very much for bringing me back on. And I'm really excited about the presentation we had today. Exercise is a priority, whether you've got chronic pain or you're one of the caregivers that are helping people with chronic pain. It's important for all of us, and we should prioritize it in all of our lives. And we need to take care of ourselves and take care of each other. And this is a primary reason that we have these kind of experts coming on to give this kind of advice. Tremendous today, tremendous. Yes, we'd love to have people get involved with Global Pain. The more people that we have, we can share with, that can watch the series, that can get on our website, get on our Facebook page, tell us how Global Pain is helping them. That's what we'd love to hear. We want to get those in our grants and in our responses and evaluations to our grantors. So let us know how it's helped, and then get on our website, globalpain.org/donate. Make a small donation so we can keep the series going. Now that we've reached 80,000 people, sky's the limit. We want to go to different countries. Obviously, we're in many, many states, but Global Pain is what it is. It's about pain throughout the world that we're trying to accomplish methods to achieve better management.
Well, let's see if we can top 100,000 in the next couple of weeks. We started with us. We went to 50, 70, now 80,000 folks who are tuning in. That's pretty cool, Susan.
Our board's very excited about it. We're looking forward to some fall plans, might even include a hybrid session if things are safe. And but we'll certainly keep the virtual series going as long as we've got funding.
Dr. Susan Blackwood, thank you so much. If you want information, info@globalpain.org, or you can go to the website at globalpain.org. And thank you so much, Susan Blackwood. We appreciate it. Now, that's it for today. Next week on GPA Live at noon, right here on Facebook, we're going to be talking to our guest, Laurel Smith, at 7 o'clock next Saturday, noon next Saturday, August 7th, GPA Live with Laurel Smith from the Alamo Area Council of Governments. She'll be talking about how ACOG is here to help, and that includes the Area Agency on Aging. So that's next week right here on GPA Live. Thank you to our executive producer and director, happens to be my wife, Gina Galavis Eisenberg. Thank you, Gina, and we will talk with you again next week on GPA Live. Have a great weekend, everybody.